Good afternoon. Today's Friday, October 23rd, 2020. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas. And today is our Titus Regional Medical Center community update. We're excited, a couple things. We're running a few minutes late, and I apologize for that. I'd like to be at 1 o'clock, spot on, or really, really close. But we're excited about some work that's happening at the health system right now. And over the last couple weeks, we started COVID back in March, and you go back and look at our first community update about COVID. In March, it was in my office, but with the window behind me, with just a couple phones doing the production. We've gone to a full studio now, and over the last 6 months, Bobby Moore has been working in a room in an office, and we've been able to take that office and expand it and go into a complete studio. You saw before the things that we had as we were coming on. So we're excited we can bring this to Northeast Texas from an education standpoint. The things we'll be able to do with this new studio, we're excited about from an education, health, increasing the health of Northeast Texas. Bobby, show them the studio real quick if you want to switch over. So you can see a full studio there, Bobby in the corner and different screens, and he's got his waving, so his wife and daughter will appreciate that. But we're excited to do this. We'll be able to do some podcasts now. Seth Alexander and our facilities team work closely with Bobby on getting this together. But we're excited about this and what we can do from a podcast standpoint and some other things across the state of Texas. But locally, it's Friday, so that means it's football. And if you're paying attention, there's a little rain outside, and cold fronts coming in tonight, so you can get your hot chocolate. And my wife said she ordered a blanket this morning to get for football games. So it's that time of year, and tonight's rivalry night in Northeast Texas. And the Mount Pleasant Tigers were off last week, and we'll be back tonight and going against our rivals in the east, 60 miles northeast of us, Texarkana. So T-High will be coming to Sam Parker Field tonight. So good luck to Coach Pinkert and the Mount Pleasant Tigers. Look forward to you bringing the win home against our rival. They may not consider us rival, but we love playing against them and beating them. So good luck, Tigers, tonight as you go against T-High. And also around the area, we have Dangerfield and Paul Pewitt. Both undefeated. Huge game tonight. So big game from there. And then go west a little bit, just down the street, Winsboro, Mount Vernon. Both ranked teams, both having phenomenal seasons. So we would like to wish from Titus Regional Medical Center to all the local teams in Northeast Texas, good luck tonight. We hope you're safe. We hope you're prosperous. Enjoy the game, get some nachos and Frito pie, a little bit unhealthy. But a couple weeks ago, we did announce when we did our update about the community health fair at Tennyson. And I just wanted to go back and thank the members of the Tennyson Church for working with Titus Regional Medical Center on this health fair. We did something different. We did a drive-through health fair, and there's some people who watched this update from other states who called us and wanted to talk to Tracy and Leanne and the team on how they did it. It was a success. We were able that morning to help cars as they came by. They put me in a perfect spot. I was in the middle of the street directing traffic, but it was kind of like a pit stop in NASCAR. And they went through, and Leanne Harlow and the team had flu shots, blood, ready to go, blood pressure. People's lives were changed that day. And I have no doubt we saved lives. There was a couple people who went to the emergency room based on their results that day, and I know their lives were saved. So thank you for everybody involved. Thank you, Tennyson, and thank you, Mount Pleasant, for supporting that health fair. I love props. You know I'm going to bring props every week on this side. But Angela and me did go vote this morning, so we did vote. We will have the elections before our next update in 2 weeks. I want to encourage you to make your right to vote and take your right to vote. Go to the polling, early voting the next few weeks, and then on Tuesday, November 5th, will be Election Day. Please vote. Your vote makes a difference. As a hospital district, and as a rural independent hospital in the state of Texas, it's critical that you vote and get the right people in office, both locally, at the state level, and at the national level. So please exercise your right to vote. We appreciate you for doing it. Next time we come to you, it'll be the day before we go live with our upgrade. You'll see some press releases coming from me and our team over the next few days on Facebook and through your email messages about our upgrade. We have signed an alliance with Ochsner Health System in New Orleans. Ochsner is one of the phenomenal health system in the United States. And what they're doing with their medical record and technology is unbelievable. Through an alliance that we would be able to sign with them, we'll have access to that. So you'll see this MyChart reimagined, your healthcare reimagined, all throughout our health system for the next few weeks as we do our go live and implementation on November 8th, Sunday. So that week will be a little hectic. And if a couple years, if you remember ago, we went through that, we'll be doing that again. So I want to say thanks to all the team members at Titus for all the work, the physicians and nurses, the clinical staff, the IT, all the different people involved in making this happen. But we're 2 weeks away, so our countdown has started. But MyChart Reimagined and the access we'll have with MyChart and what we'll be able to do with it will be great for this community. The MyChart that they have at Ochsner is the gold standard, and we're excited that we'll be able to have access to it. Healthcare has a lot of different weeks throughout the year. In October, there's a lot of things going on, a lot of recognition. And I just want to take a few minutes of this update, not to tell you about what we're going to do and tell you about the accomplishments coming forward, but just want to share just a little bit about who we are today. I want to say just thank you to our pharmacy team. We have a great pharmacy team led by Ruth, and Ruth Sabacki and what she does for our pharmacy at Titus. She's been here for quite a few years, and her experience and leadership and the team that she has to support her is unbelievable. And the things that she does, I truly appreciate their team's work, and wanted to give a shout out to Pharmacy Week 2020, Pharmacy Strong 2020. We have another group that sometimes doesn't get mentioned a lot, and if you have a stay in the hospital, they come and visit. It's our case management team, and they do a great job. Katrina is leading our case management and social worker team and different things, making sure that everybody who comes in the hospital has what they need during their stay and when they leave. This is a great group of young ladies who's doing some things to improve the health care of our community on a daily basis. So to that team, just want to say happy Case Management Week, and we appreciate what you do. Sometimes they do get forgotten, and we just want to say how much we appreciate them. Last week, since this is 2-week increments, was Emergency ER Nurses Week. You're going to use them some points in your life, and you want those ER nurses and the team in the ER ready to go. I will tell you, Titus is a level 3 trauma center, and our ER staff, physicians, nurses, all the clinical people in the ER are doing some great things. And from stroke times, from door to needle, from door to pump in our cath lab, they're doing some great things in our ER. So just wanted to celebrate them for a few minutes. We've been lucky over the last few weeks or few months now. Time flies when you're having fun. But Cynthia Gaddy has joined us from Hawaii. She's now our Vice President of Critical Care, and she's working closely with this team in ER to change our flow. We'll be doing some changing the interior, the lobby over the next few months, and some construction down there. So we're excited about what's happening. This is the front door of our hospital, and this team down there does a great job. October is a big for a lot of different reasons, and said I like my props, but I want to say a shout out to our women's breast center here at Titus over in the Medical Plaza, the 3rd floor. It is Breast Cancer Awareness Month, and I want to thank that team. They are giving for mammograms this month to people coming in these masks, beautiful masks, and your hand sanitizer. Sorry, had to get a little tricky on that, but your hand sanitizer for everybody who comes in the month of October. These are cool masks. Penny, register over there, does a great job when you come in and welcome you. But the whole breast cancer, the women's team over there just does a great job. We are excited to announce on Monday night we'll be taking to our board of directors a capital purchase, which will be the investment of a new Tomo system and a 3D technology, and it will increase the technology we have for mammograms and to fight breast cancer. Only fitting that this would be approved or be submitted to our board on Monday night during Breast Cancer Awareness Month. So we're excited about that. National Physical Therapy Month. We also want to shout out to Kevin Askew and the team, both in the hospital and in the Medical Plaza in the outpatient physical therapy. Titus is blessed to have some of the best physical therapists in Northeast Texas work at this health system. And what Manny Pugsley and the team on the 5th floor in inpatient rehab, the people that work in that group and the people who work over in the outpatient, they do a great job. And they've helped my parents, they've helped my family over the years, and just want to shout out to Kevin and his team for the work they do. Thank you, Kevin, and thank you for everybody in our physical therapy group. The last one that we're going to talk about today is our Healthcare Quality Week. We're doing a lot of different things in Titus, and one of the investments and initiatives we'll talk to our board on Monday night is our focus on quality and patient safety. Chris Bell has taken over the leadership of that team as our Senior Director of Quality in the last few months. And we're excited about what the team she is building and things that they're going to be do on a consistent basis. We are ranked highly in quite a few different areas and service lines in the United States for our quality and patient safety. And this team does a great job. So I want to thank everybody and our quality team. And we'll be adding some people over the next few weeks, and we'll be welcoming them as well. As we move into COVID and discussion, I just want to talk about GoGetTested.com. It's a group that's doing testing here. They've been here for several months, and we truly appreciate it. Right now, they're over off 271 next to the Tiger Mart. Their website is GoGetTested.com. If you need a COVID test for any reason, just to check and see if you have fever or to see somebody in the hospital or see somebody in a nursing home or long-term care, this group is doing a really good job. Want to continue to advertise for them and just put their website out there. I know my mom used it this week to get tested. It was easy to get it online and set it up, and they did a great job. So shout out to the young ladies that are over there at GoGetTested.com. But if you need a test, feel free to go to that number, that website, and check it out. As far as the health system at Titus is concerned, the numbers 2 weeks ago, we told you to increase a little bit, and we're still seeing it. We're seeing this week some increase in positives on an outpatient basis. From a hospital's perspective, we have 4 in the hospital this morning. We've been running about 1 or 2. The last few days, we've had 3 or 4. So we're seeing a little bit of increase. The state of Texas, especially my friends in El Paso and the Panhandle and west of Dallas, seeing a huge increase in cases from COVID. But we have not seen as high here, but we still see those 2 to 4 cases on a daily basis that are in the hospital, and we're seeing anywhere between 5 to 10 positives on a daily basis. This week's been a little heavier the last 2 days than normal, but we're watching it closely. We appreciate what everybody's doing inside the hospital to make sure that we continue to fight COVID. Again, I just want to thank you for the opportunity to give you the update this week. 2 weeks from now, we'll go live with Epic. So that'll be an exciting go live So we'll do probably earlier that day, do a go live and getting ready for the community update as we go live with Epic on November 8th. So thank you for the opportunity to serve in this position, and thank you for the opportunity to provide healthcare for Northeast Texas. God bless.